And one thing that the ACEs study really helped to begin to shape a conversation where children were being asked what happened to you, as opposed to the thinking about what's wrong with you, why can't you sit down, why can't you listen, you know, now it's what happened to you. Let's talk about what you know is going on at home. Let's talk about what you might have
changing the conversation to what happened as opposed to putting it back on you. Now, the role of poverty, I was reading, and I basically want opinions on this. It had to do, does America hate poor people? And so I'd like to hear both of y'all's opinions on that. Does America hate poor people?
I mean, I would say that it hasn't.
Or despise. Let's say despise. Let's say that might be better than hate.
Yeah,
Right.
I mean, historically, when you look back at the setup of our social welfare system here and how we have historically managed poverty in the United States, back from the very beginning, we haven't been showing a lot of love and support to those who are at the bottom of our economic rungs. So, we always have this distinction between the worthy and the unworthy poor, who actually deserves help in our society. And we make those distinctions very clear. And those definitions have been evolving over time. So it used to be back at the beginning of our country that if you were a widow or you were a child, then you were worthy of assistance. But now even that has evolved to, well, if you have a job, then maybe you deserve assistance. But even now, when you look at some of the earning levels of people, it's not even if you have a job, if you have a relatively well-paying job. So, this is a constantly shifting definition of who we determine in this country actually deserves assistance and who does not. And we see that playing out in our communities every day. Aleciah talked about the historic, pervasive trauma of the history of racism in this country. We talk about the trauma associated with poverty frequently overlaps with communities of color, and it just intensifies that trauma, the trauma of not having housing that is stable, of constantly moving and losing your support systems. That trauma is very real, and it's throughout family systems.
Would poverty be considered a trauma?
Absolutely.
And then when we think about poverty and the pipeline to prison, can you speak about how the intersection and how that sort of plays out in some of these communities that have trauma?
Absolutely. Look, communities of color are absolutely targeted by our criminal justice system. You can't say otherwise. It's it's very clear when you look at the data. And based on some of the research FPWA has done recently, there's an absolute correlation between poverty and criminal justice involvement. There are entry points throughout living in poverty that bring you directly into the criminal justice system. You can't afford a Metro card, and so you jump the turnstile, and that brings you right into the system.
Can't afford bail.
Can't afford bail, and so instead of being released, you are sitting in a prison. And what does that do not only to the individual, the trauma of being incarcerated, but to the entire family system? And we're not talking about that as a community. We're not talking about how we are traumatizing entire families, entire communities with our criminal justice system.
But just to, what you said earlier, going back to social welfare policy, poverty is also, we've dealt with it as a Band-Aid. We've fostered, our social welfare policy has really fostered dependency and the lack of education, the lack of moving forward, and that's all part of where we are. And there haven't been many changes historically to our social welfare policy from back in the day when it was first established. But dependency is a big issue, and one could always ask, well, why do we have that the poor stay at one level and never are able to move up, and why haven't there been programs that have become more in the times of helping different families and organizations and poverty-stricken communities and groups?
And Nomiki, what you just said, things haven't changed in a long time.
No, they have not.
But keep in mind that trauma has not been in the forefront. We haven't looked at trauma.
No, it's been your fault.
Part of it.
You're poor because it's been your fault.
Yeah.
You either weren't smart enough, you weren't ambitious enough.
You didn't make the right decision.
Right.
Now I'm going to penalize you.
Right.
So as we change and look through a trauma lens, all of these agencies that deal with people, the criminal justice system, our social welfare agencies, all our schools, all of our areas that deal with people, once they start broadening their lens that they look through to include trauma as, part of what they look at, then things can change.
You're talking about trauma-informed models.
Trauma-informed
So let's talk about what that
environments.
looks like. A trauma-informed environment or model. What does that look like?
When we talk about trauma-informed models, it's really coming out of the healthcare center. I mean, the healthcare network, right? And thinking about how to create a collaborative system of care, right? How to get physicians and clinicians and social services all together.
To care, it sounds like.
Right.
Just care.
That's right. And how do you get them all navigating and working together? We see some impressive stuff, again, coming out of California. I hate to keep talking about California because, we in New York. But you see some impressive stuff coming out of community-based organizations with community solutions in terms of their trauma models and creating healing centers. And
what do you mean by a healing center? Because when I think of a healing center, I might think of church or faith-based organization.
well, we could talk about that too, and what the church needs to do. But a lot of the programs, especially coming out of an indigenous background, look at creating healing circles and talking about what's happening in our communities. And then how do we also begin to transform our physical space, right, to equate itself to that healing process that we're trying to do. There's a lot of research on what physical spaces look like in communities, struggling communities versus communities that are not struggling, and how that feeds or not feeds in trauma.
You mean like no parks?
That's right. Buildings falling down.
Right. Okay. Broken windows.
That's right.
Okay.
And so there are some models that feel like those things need to be incorporated amongst themselves. And now recently there's a lot of models around training and what training looks like. But yeah, those are some of the models.
So how do we build resiliency? Because I think that's fundamentally what we're talking about, where people don't continue to absorb messages around lack of empowerment. So how do we do that? How do we build resilient communities?
I believe we have them. I think we have to listen to them. I think that's always going to be like foremost, at least for me, is the recognizing that people that are going through the issues just know what they need to survive those issues. And so listening to those people, that's first and foremost. I think we have to be aggressive in our ability to stand up against injustice, right? And that includes in systems and policies and practices. And especially as a nonprofit sector, we have not begun to tap the power that we have. The nonprofit sector is one of the biggest, right, in this country. And so why are nonprofits
You're talking about the human services sector.
Yes, human services. Why aren't they working together in a aligned strategy to really tackle this? Like, imagine what that could look like.
So what's you all's vision around that in terms of what that could look like?
Right. I think it has to be a twofold process. There has to be substantial policy changes, and there have to be programmatic changes as well. And really, again, like Aleciah said, led by those who are the experts. The phrase is those who are closest to the problem or closest to the solution. And so really led by communities. What is it that communities need in order to address some of these problems? But on the policy level, we are looking at best practices and examples from across the country. So FPWA just finished a process creating a list of recommendations to address the poverty to prison pipeline. And one of those is creating a trauma-informed city. What would it look like if New York City and our city services were truly trauma-informed? So
What would that look like?
I mean, it might look like walking into a single-stop center and thinking about environment. How does
it look? How are people received?
Right.
How are staff trained when that person first enters in terms of the intake process?
Treating
Each other. Yes.
Right.
Yes.
Very big.
I think also that, bringing out the individual strength of the community helps. When you do any group process, it's starting with the individuals, hearing them out, bringing them, find the common cause to bring them together, and empower that togetherness to then start both the healing process, the repairing process, along with all the supports, obviously. But I really think that communities also need to feel that even underneath all that trauma, they have strengths, and those strengths need to come together.
And those images, and that has to be brought up to the larger society. Because we live in situations now where people are othered. We're othering people all over the place. And that needs to change as well. You're going to say something,
I want to say that I think when we think about trauma, people that have experienced trauma, the one thing that they want is safety. And when I think about on Maslow's hierarchy of needs, safety is way up there with what's important to us. And so as we think about these communities and somehow mitigating the trauma that they've experienced, we've got to look at how we can make the people within these communities feel safe. That's going to be
But that
the
starts
beginning
in your
of the
home,
healing.
right? Wouldn't that start
It
in,
can,
I mean,
but if we're
in
looking
the
at
home
a
and then
com-
broader, of course.
If we're
But
thinking of a community, we've
Right.
got to think about the police officers that are there.
Right,
now,
right,
what
right.
disturbs me is that there's in many communities, there's a mistrust of the criminal, the people that are supposed to be keeping them safe. That can't be, you can't heal when you feel that you live in an environment like that. So we've got to look at the institutions that are supporting these communities, help them to understand trauma, get them to drink the Kool-Aid, so to speak, to understand the part that they play in the healing and have them want to do it and start working towards it.
I would also say that we invest millions of dollars as a city in some of these systems that are re-traumatizing. And what would it look like to invest instead in some of these systems that are supporting?
so what do we need to do to help you make that happen?
Well, Alicia's the one with all of this.
What do we need to do? Because we're about ready to wrap, and I'd like to wrap on a positive.
No,
What is it that
absolutely.
we can do to help you make that kind of work happen?
So FPWA has a program called Courageous Conversations, which is really focused on trauma-informed care, trauma advocacy, and hopefully one day we'll be trauma-free. And so our work there in that space is to really work with nonprofits and institutions and their staff to really think about and envision what a different world could look like. And in order for that to happen, we have to open up space within our institutions to realize that people have gifts and they have talents. And if they're able to fully bring those to the table, right, we're in a better position to be advocates for this work and really to dismantle the systems that were put there to help us.
Well, you know what? That's an excellent place to close. But thank you so much. And as you can see, these ladies are in the trenches. You're doing really great work. And we're going to see you again. Thank you, Phyllis Whitethorn. And thank you, Nomiki McCrillos. Thank you. That's all the time we have for this episode of Brooklyn Savvy. We'll see you next time on Brooklyn Savvy. This program is brought to you by Verizon and Investors Bank.